Welcome to We the World and our 2025 MLK Manifesting the Dream event. Each year, we take time to remember Martin Luther King Jr. and his beloved community. And each year, we are thrilled to feature the many people and organizations who have taken action to be of service, not only in January and February, but all year round. We at We the World welcome you to take action and be of service at we.net/MLK from January 15th to February 28th. Please join us in being a part of this annual celebration and consider being of service in your communities and with us. Of course, donations are very appreciated at we.net/donate. My name is Jana Larson, and I am the HR Deputy Director of We the World. Today we have a very special program moderated by Subrata Banerjee, who is a member of our We team. He is an international development professional with over 15 years of experience in child protection, gender equality, social inclusion, and women's rights. He has worked in more than 20 countries in the global south, as well as the US, UK, Austria, Germany, and the Netherlands. With extensive experience collaborating with UN missions and the World Bank, Subrata has advised national governments across Asia on human development, child protection, and gender equality. His work has influenced public policy reforms and strategic program implementation, advancing the rights and well-being of children and women. Welcome, Subrata. We're looking forward to a wonderful conversation. The talking feather is now in your hands.
Thank you so much, Jana, and I'm really very happy today to be present in this kind of very important program in memory of MLK Jr., Martin Luther King Jr. So today we will have our very special guest, Dr. Juhi Garg. Juhi Garg is one of the most prominent as well as very passionate professional, especially in the areas of women empowerment, gender equality. She has been working for a long time, and she has diverse background in academia as well as social sector development, and her focus is mainly on financial inclusion and women's empowerment issues. And she has been proactively working for a long time, especially in the areas of skilling young girls, skilling young leadership, as well as young girls skill development, and how to empower them to gain full employment. So today she is with us, and I would like to we will have the opportunity to have this kind of very important conversation on health, public health, and gender issues, public health and women. Because in today's world, health is one of the most important and as well as critical area of concern, not only for the entire public, but also for the very critical issues of women, girls in every society. So given that conditions, given that area of concerns, one of the most vulnerable sections of society, girls and women. So in that respect, Dr. Juhi will be talking about this, and we'll be in a position to understand what kind of things are going around, what kind of work she has been doing, and what are the areas of concern she found, and what are the challenges, and how she finds that these challenges could have certain kind of pathways in future course of time. Thank you so much. Now I would like to hand over this charge to Dr. Juhi Garg to speak on this very important issue. Thank you so much, Dr. Juhi.
Thank you so much, Mr. Banerjee, for having me here. It's an absolutely a wonderful opportunity. Thank you, Jana and Birgit, for inviting me to this forum. I've been reading about the forum. It's a wonderful, wonderful place to be, and what a fantastic work you people are doing. I really, really appreciate and would love to be part of your work in any which way possible. So, yeah, I mean, if you talk about my work, thanks for the elaborative introduction that Mr. Banerjee has given. Yes, for past a little more than past 2 decades, I've been working in education, higher education, women empowerment, and financial inclusion of women from the vulnerable sector of India. My work area, my geography is primarily in India, and in India also, I am deeply focusing on my own state that is called Uttarakhand, which is also known as Devbhumi. And I'll give you a little picture how India is behaving. What is the status of public health in India? What are the critical challenges? What are the strengths? Some of the beautiful steps that government has taken, and some of the critical issues that Himalayan region, states with special status in India, what are the sufferings of these states when it comes to public health and education. So there's I would like to share a few data and the researches that got published, and it is in public forum. uh, First research I would like to mention about the IBEF Foundation research, which is the most recent researches, Feb 2000, Jan 2025. So, how India looks when it comes to public health and what are the strengths that India has. So, as we all know, that India is a beautiful nation, most populous country, and the youngest nation in this world. And this particular kind of a scenario makes it very different because where it is most populous, where it is absolutely diverse in terms of culture, food, in terms of language, and folkways, it brings a lot of challenges, of different terrains. Still, as a nation in total, what are the various strong demand factors? What are the various interesting facts that India has as a nation? So the researchers has been endorsing that Indian healthcare market, which has valued, US 110 billion dollars in 2016. Now it has been projected to rise up to 638 billion US dollars by 2025. So by this year, it is going to be a massive, massive economy. The healthcare sector, as of now, is one of the India's largest employers and employing in total of 7.5 million people, and it is going to rise, by a few more millions only in the coming years by 2030. The demand for Indian healthcare professional globally is very high. And various researchers across globe have endorsed that Indian healthcare workers, Indian healthcare practitioners, specifically doctors and surgeons, are world's leader in their own practice. And it has been doubled. It's going to be doubled by 2030 due to the shortage of healthcare workers in India, where right now, where there are only 1.7 nurses per 1,000 people. This is the biggest challenge. So the supply of healthcare workers in proportion to the rising population that we have is very, very critical here. So WHO guidelines says that 1 is to 1,000, one doctors to population ratio should be 1 is to 1,000. But one of the or two, three researchers, recent researchers have shown that we have bettered the global, benchmark, and we are about 1 is to 900. But another research says that we are 1 is to 1,500. So there is a discrepancy in researchers because one is doctor versus population, another is doctor versus patient. So doctor versus patient ratio, we are far from the standards. And similarly with nurses, we are also very, very it's critical to have a lot of nurses and other healthcare workers. This is a big challenge, but this also gives rise to a lot of opportunity in terms of rise in education sector in healthcare. So government has taken wonderful steps by opening AIMS, All India Medical Institute, so which is a government agency and finest government agencies, finest government medical colleges. So it is going to have one AIMS in every state very soon in coming years of time. Government has also opened certain state hospitals and elevated the community hospital status to the state hospitals. So this is again showing that how strongly we are moving ahead with the criticality of the discrepancy in human resource supply and demand, right? The another attractive opportunities that we have as far as India is concerned, the public expenditure on healthcare has touched 1.9% of GDP by financial year 24, and it is going to be increased by 2.5% by 25. So almost, almost like double, so to say. Then Indian healthcare sector is witnessing unprecedented growth with private equity and venture capital investments. So earlier, about 10 years ago, the maximum investment in healthcare sector, when I talk about the massive infrastructure, super specialty hospitals and things like that in TI cities, it was mostly done by with the government funding. But now a lot of private funding, venture capitalist funds, and otherwise international funding has been happening, especially after COVID, which has given great rise, about 220% increase from the previous year. How we are rising our manpower, as I said, a lot of new hospitals are opening, a lot of new medical colleges are opening, and this is going to decrease the manpower supply and demand gap. But it is going to take another 5 years minimum to meet this kind of a gap. So availability of large and well-trained medical professionals in the country, but still we are not WHO standards. We are not meeting that standards when it comes to doctor-patient ratio. Where are we still lacking? The biggest challenge. I can tell you that there are certain good things. What are the prospective growth patterns that we can foresee for India? How the India is reducing the manpower gap? But the biggest problem when it comes to policy, government has some wonderful policies and schemes too in place, but the implementation of the policy and the corruption is still the biggest challenge that needs to be met by the government and need to be catered very, very strongly. If that is met, a lot of things are going to be sorted. If I tell you, this is holistic picture of Indian healthcare sector, and this is an absolute research and data which has been shown by IBF, and I have some other data also, the WEF data, World Economic Forum data, UN Women data, which talks about the vulnerability of Indian healthcare or public sector status, and specifically with special reference to gender gap. We stand at 142nd rank out of 147 nations, which has been surveyed by World Economic Forum in gender disparity. So we are far too below than the expected, the expectation, the vision that we have. And a lot of the ranking goes low, especially in certain terrains of India, in certain special status, states like Uttarakhand, where I belong to. It's a Himalayan range. So all the states which are into Himalayan ranges are the biggest sufferers because the terrain is difficult. People live far, in deep hills of the Himalayan region. The accessibility of the healthcare systems there is very difficult, and demand supply gap has risen to greater strength. India has, has a lot of brick and mortar hospitals and public and community service centers. But the research has shown that these centers, these public healthcare centers, have not been utilized optimally, and that's the biggest challenge. When I say these public healthcare centers are not being utilized, public health centers or PSCs are everywhere in every village, every gaon of India. And above that comes the community health center. So both community health centers and public health centers are not optimally used. Why it is not being optimally used? Because of the lack of human resource which is going to govern it, run it, implement it, and function it, make it happen. So these institutions, these brick and mortar structures are present at the nook and corner of the country, but they are either ghost institutions, ghost hospitals, and public health centers, or is not being utilized to the capacity it should be used. We have funding, government support is there, a scheme is there, but the challenges lies there. Where government is lacking because we have a very poor human resource policy which needs to be catered with intense, with great amount of focus in next few years. Otherwise, we're gonna lose a lot of infrastructure and faith amongst the people. So one of the models in Assam, what Assam has done, one of the again hilly terrains of India, what they have done with every PHC, public health centers, they have a residence for the doctors, and doctors can bring their families and children along with them, and they can stay there for a longer period of time. This is not the case in other states of the Indian hilly terrains. People, the education infrastructure, the health infrastructure is so poor, and the living, the infrastructure to sustain a doctor and other health practitioners in hilly terrain is very difficult because there's no availability of such resources, such infrastructures. So even if doctors has a mandate to serve in a certain region for a certain period of time, they don't reside there, they don't stay there because they can't bring their families. Life is very difficult in those terrains. So where we need to focus a lot on the demand and supply side, and specifically in developing the infrastructure to a level where doctors can be sustained and they can perform their duties. These are the few insights. If I talk about, the biggest challenges amongst women, I have another beautiful report by, I'll tell you, which talks about what are the top healthcare disease or disorders which exist in Indian females. Indian females are absolutely very vulnerable, and research says that most Indian women are affected by these disorders or diseases in their reproductive age and the age where they can do job and contribute to the economy to the most. So between age 20 to 65, 70, they get affected by most of the disorders that has been listed in the list. The whole population suffer. Cancer is not only breast cancer, cervical cancer is not only affecting India, but globally it is affecting females. And one of the researchers says that out of 8 women, 1 woman is the victim of breast cancer. And the unfortunate part is that breast cancer can be very easily detected in very early stages. But there is no sensitization about early detection techniques, self-examination, and public mass examination drives and missions. So breast cancer is one big reason. Second comes cervical cancer. There has been the vaccine is already there. Government is focusing on vaccinating young girls pre-marriage age or early marriage ages, but uh, we need to gain this momentum. It is going to take a few more years because the population is very, very high. India has 48.8% females out of the total population, so gender gap there also exists. Then we have most vulnerable other diseases that a woman faces is colon cancer. Then we have liver cancer, mouth and oral cancer, mostly in men and then in women. Asthma is there, rheumatoid arthritis is massive problematic factor that women faces. Then epilepsy and some of the mental health disorders. Other few things how we can primarily cater to these problems, especially in these special status states of India. First, we need to increase the functionality of optimum utilization of available resources that we already have in terms of brick and PSCs and CHC centers, district hospitals, and so on and so forth. The audit has to be done periodically, and the milestone needs to be set. Gap assessment has to happen so that we can work only on the areas which are gray. And training needs assessment also needs to be done with great rigor. So public-private partnership for healthcare facility is very important. Right now, we have this in existence. A lot of public-private partnerships are happening, but because of corruption, because of red tape, I mean, certain other challenges that comes with population and nepotism is affecting the public-private partnerships. Some of the bunch of the people are promoted, the meritorious organizations are suffering. And these are the areas where the public-private partnership can play a major role, like telemedicine networks, mobile clinics, ambulance networks, healthcare facilities in the underserved locations. When it comes to governance, community-based healthcare system needs to be developed. Community health councils can play a major role with local government bodies. Focus on Ayush. Ayush is all about alternate medication, not the English medication, but alternate medication when it comes to Ayurveda, Unani, and other forms of homeopathy, forms of treatment. Focus on preventive care is absolutely poor in India. People only go to hospitals when they are ailing and they are into the dangerous zone, and they don't go for preventive care. They don't go for regular checkups and things like that. Still, preventive healthcare centers are not very profitable units, so to say. And what can be the solution for that? The only solution is to sensitize, massive sensitization drives in the schools and community centers. So from the very beginning, from the childhood age only, the kids must know that why they need to go for the preventive health care, what are the various factors they can avoid certain disorders and diseases, and be okay in terms of health. Create special medical zones. This is important. This has been happening in certain states and doing very, very well. In Uttarakhand also talks are on, and there has been a land which has been identified by the government for a special medical zone. And this is going to be a complete city where every imaginable medical and allied facility is going to be available. And this is going to further help medical tourism gain momentum. Already medical tourism in India is doing very, very well, and Indian doctors are trusted globally. People come because of quality treatment and low cost factors. What I can tell you is about one of the, my last, in inclusion would be the government most promising and the best mission or scheme which has been launched by the government, the present government in 2018. It is known as Ayushman Bharat Digital Mission under Digital India scheme. And Ayushman Bharat, Ayushman means long live Bharat. Bharat is India. So how India is going to long live? So it's basically about digitization, the complete ecosystem of healthcare, complete ecosystem. So when it's about making registrations of each citizen, and they should have the Ayushman card in place, which is insurance scheme, public insurance scheme. Secondly, the registration of all the medical practitioners, whether it is English medicine or whether it is Ayush medicine or any other allied sector. Registry of healthcare facility, whether it is a small hospital, government or private, or it is a super specialty multi-unit hospitals like that. Also, the unit health insurance schemes and interfaces, where all the companies, insurance companies, which has medical claims and medical schemes and things like that, all these facilities are going to be there on the one platform. This digital data is going to help the government to deal with the massive problems in pandemic-like situations also, and they can plan the medical healthcare systems of the future, future. They can forecast a lot of things. So right now, the government digital Ayushman Bharat Digital Mission says that I can share the the exact data that they claim, that 73 crore 89,000 people, 89 lakh people are already ABHA members. Means half of the population has already registered under Ayushman Bharat scheme. Out of that, 48 crore 80 lakh people are linked with their health records. So whether a super specialty hospital in Bangalore is going to treat a village, a remote village, very, very remote village in Uttarakhand, people can treat that because the record are already there on the platform. And telemedicine can help. This Sanjeevani is also the government's platform, which helps people get the free telemedicine support to all citizens of India. Then there are about 63,000 people which are registered as a healthcare facility, and 5,62,000 something healthcare professionals are already registered. And the numbers are huge. It is progressive, it is rising each moment, each second. It's a live data. And India is going to have a great future, I'm sure. But nepotism, corruption, and implementation needs to be dealt very, very seriously. Violence against women is one of the critical factors which causes mental health disorders and crime in the society. Certain disorders I've already named. Diabetes and hypertension has been the lifestyle diseases amongst men and women both, but it is impacting women more because they play various roles. India has a different culture. A woman is supposed to handle the house, children, other chores, and then their work also. And most of the Indian female population is serving uh, and not getting paid for their services because they are domestic help, they're working for their households and things like that. So mainstreaming women in the job sector is also very important. And my last point would be that I was told to also include what exactly I am doing and how I am contributing to these causes. Is primarily my agency, my organization deals only with women in four sectors, four pillars, which affect women greatly. One is their health, as I said. So we organize a lot of camps around women and community, and talks about preventive healthcare, specifically in for breast cancer and menstrual health, hygiene, and sanitation. So for this work, we have been also given SDG Goalkeeper Achievers Award for SDG 5 in 2023. Then we work on training these women and onboarding them, mainstreaming them in the job sector. So we train these females from the vulnerable sector, we onboard them as an employee in our organization and make them work for other agencies. We are basically an outsourcing company, and I have one recognized impact first startup, and another one is a foundation, which is a trust. And then we also work a lot with the women entrepreneurs from the Grameen areas, the village areas, the rural areas. So I'm associated with certain CSR projects and things like that. I hope this suffices what I'm supposed to be sharing. Anything else, Mr. Banerjee?
Thank you so much, Dr. Juhi. I would like to thanks to you, especially for your detailed understanding and detailed report, detailed discussions on this particular issue. And I just want to add one thing, that in India, India has, there is no dearth of talent in India. There is no dearth of money in India. There is no dearth of world-class doctors, medical facilities, everything in India. Even when I went to Europe, I found many so-called advanced nations. They are lagging far behind India in terms of technology, in terms of care, doctors' care, and the system, overall system. But here, the most challenging things are manifold. One is there are very good policies are there in every sectors, including health.
Yes.
gender, health, everything. But no one is taking any responsibility to implement it properly. This is the one thing. And the second thing is that there is a good network of doctors, good world-class doctors. They are working across many countries, and one of the you can say that world's top-class engineers, doctors. They are all, mainly working in US, UK, and many other highly developed countries. But we are not in a position to hold back this kind of talents in our country. But they are not only working as a specialist doctor in big hospitals in America, UK, but also they are teaching in medical colleges, very renowned medical colleges, and they are big name in science. And a good number of medical scientists, they are working in America and many other countries. This is good thing. They are working for the entire humanity. That is the good thing. And we have in India lots of good doctors, scientists, engineers, medical doctors, medical scientists are there. But the only thing is that it's need government support. It needs government's serious support to make things happen, because due to problems of healthcare systems, due to problems in healthcare issues, challenges, mostly women, children, and as well as adolescent girls are suffering a lot because of social pressure, because of various other issues, deep social structures due to traditional systems of society. So women and young girls are suffering a lot. But again, there's a lots of scopes to do this kind of work in India and across also many other countries of Asia region. So due to this kind of challenges situation, because of public authorities problems with the implementation and many other issues, so we are not in a position to bring this kind of services to these people, especially the young girls as well as women in India. So I think this is very good understanding and very good discussions on this. It is very, very linked to gender. And if we don't care about healthcare issues, challenges of women, girls, then if healthcare is affecting a large number of women to attend their schools, colleges, as well as to workplaces, then automatically it will hamper the national economy at large. So half of the humanity are women. So if women are prevented from education system, if they are prevented, if they are not in a position to attend the workplaces, systems of work culture, then it will be a great loss for India and many other countries. So in line with that kind of situation, I think this is very, very critical and important area of concern, issues in relation to gender, in relation to public health issues, and in relation to the support system that need to be developed in course of time, so that each and everybody, men and women, boys and girls, equally participate, equally have the access, the opportunity to best healthcare systems, and they will be in a position to participate in the economic activities. So that's all from my end. Now I hand over to Jana for taking forward this kind of discussion.
Thank you for this very fascinating conversation. It's been very informative. Thank you so much. Thank you also to Brigitte Ben Ali, our events director, and my tech assistant for today. Thank you to our viewers for joining our broadcast today. And remember to please join us and take action to be of service at we.net/MLK. And donations are gratefully appreciated at we.net/donate. Goodbye from all of us at We the World.
Thank you so
Thank
much.
you so much. Thank you so much.
Thank you
It was
so
a
much.
pleasure
Thank
having
you.
you. Thank you.